Good afternoon and welcome to Homeland Center. We are at a location that 154 years ago our organization began. First structure directly behind you to the left, built in 1870. We began serving widows and orphans that were an unfortunate result of the Civil War. Now 154 years later, we're here, and we continue to build on the commitment that began in 1867. A commitment to provide the highest level of quality of life, quality of care, and service to the residents, patients, and clients that entrust their lives to us. That is the basis of why it is an honor and pleasure for our organization to host this historic announcement to improve the skilled nursing quality of care and life of residents throughout Pennsylvania. I'd like now to introduce our honored guests. First, Acting Secretary of Health, Allison Beam. Acting Department of Human Service Secretary, Meg Sneed. Department of Aging Secretary, Robert Torres. Department of Military and Veterans Affairs Executive Director of Long-Term Care, Travis Davis. State Long-Term Care Ombudsman, Margaret Barajas. LPN Kim Jackson, who has over 20 years of nursing home experience in Eastern Pennsylvania. Thank you all for attending today. Secretary Beam.
Good afternoon, and thank you, Barry, and your entire team at Homeland Center for hosting us today for this historic announcement. Standing up for vulnerable Pennsylvanians has long been a passion and driving force in my life. Long before COVID-19, before I was appointed acting secretary, I was working with the Department of Health to update skilled nursing facility regulations. Now, leading the charge for the Wolf administration, I can tell you that we are taking an aggressive approach to ensure that nursing home residents get the care they need and deserve. At the same time, we need to improve working conditions for nursing home staff. We know that when staff burn out, resident care suffers. We also know that skilled nursing facilities and long-term care facilities were disproportionately affected by the impact of COVID-19. The Wolf administration is committed to continuing to provide robust, ongoing support for these facilities because it will be critical in their efforts to battle the pandemic and protect residents and staff. That support has included not only the provision of personal protective equipment, but also infection prevention, technical support, staffing support, outbreak response and testing, and quick access to the life-saving COVID-19 vaccine. It truly has been a team effort working with the Departments of Aging, Human Services, Military and Veterans Affairs, and others. And thank you all for joining us today. We are committed to continuing the assistance needed to protect residents and staff. That's why I'm proud to have the support of this team as we take this bold step forward for Pennsylvanians in nursing homes and staff who care for them 24/7. Today, the Department of Health submitted the first installment of proposed nursing home regulations to the General Assembly, the Independent Regulatory Review Commission, and the Legislative Reference Bureau. I want to thank all of the interested stakeholders, including industry groups, resident advocates, and others, who have met with the Department of Health staff in the past couple of years to provide input into how the regulations can be crafted. We heard you. We know that everyone involved wants to ensure that residents receive the best care possible because that is what they deserve. This is a historic move because the current regulations have not been updated in nearly 25 years. This is problematic for many reasons, including the fact that the number of older Pennsylvanians is increasing and the number of those needing skilled nursing facilities care will also rapidly increase. It's estimated that an individual turning 65 today has an almost 70% chance of needing some type of nursing care during the remainder of their lifetime. Outdated regulations have ignored industry changes and best practices related to person-centered care. That's why we are proposing to align with federal regulations. This will allow Pennsylvania to remain current while also avoiding another generational lapse in regulatory updates. Publishing these proposed regulations is another step forward for the department's and the Wolf administration's ardent support for residents' well-being and increased quality of care. The proposed regulations being presented today increase the minimum number of direct resident care hours from 2.7 to 4.1. That's an increase of 1.4 hours per resident, but it could greatly improve the quality of care residents receive. We know that 4.1 can be done. In fact, of the 692 skilled nursing facilities regulated by the Department of Health, 125 of them, including Homeland Center, already provide at least that level of care. 134 provide between 3.5 and 3.99 hours of care per day, and another 334 provide between 3.01 and 3.49 hours of care. Providing 4.1 hours of direct care not only aligns with best practices and existing research, but it prioritizes resident well-being. This is an especially necessary approach after the tumultuous and trying year and a half of the COVID-19 pandemic. It's been 20 years since the U.S. Centers for Medicaid and Medicare Services first established the importance of having 4.1 direct hours of resident care. Numerous studies since have reaffirmed the point that a minimum of 4.1 hours of direct care per resident each day has a direct impact on the quality of care. Studies have shown that this is the minimum level of care needed by nursing home residents to prevent such problems as bed sores, infections, malnutrition, dehydration, and injuries from falls. Let's take a minute and review how we got to this point and what's next. Recognizing the need to update the regulations, the Department of Health convened relevant stakeholders starting in 2017 as part of a regulatory work group to provide feedback on these issues. The work group continued to meet throughout 2018 and provided the department recommendations on how to update these regulations. When drafting the proposed regulations, the Department of Health team incorporated many of these recommendations, as well as the critical lessons that we were learning real time while responding to the COVID-19 pandemic. Given the magnitude and the importance of these regulations for the more than 72,000 nursing home residents and their families, publishing the proposed updates in 5 packages will allow each section the opportunity for appropriate feedback during a public comment period. The first package is what we are announcing today, and it's on track to be published in the Pennsylvania Bulletin by the end of the month. At that point, all interested stakeholders, including industry groups, resident advocates, and the general public, will have an opportunity to provide feedback. Future packages will include potential updates to other critical topics, including ownership, staff development, infection control, and prevention. Each of those 5 packages will follow the same process to allow for public comment. The department plans to submit final form regulations as a whole once all 5 packages of updates move through the state's regulatory review process. Of note, the regulations will only apply to the 692 licensed skilled nursing facilities regulated by the Department of Health. Personal care homes and assisted living homes, typically housing residents with less acute healthcare needs, are regulated by the Department of Human Services. I can assure you that the Wolf administration is looking at long-term care in a comprehensive manner, and we are committed to getting proposed updated regulations through the regulatory review process by the end of 2022. The Department of Health and the Wolf administration are very interested in and look forward to receiving feedback on all proposed rulemaking packages during this public comment period. We stand ready to support the industry during implementation of these proposed changes. We understand that these changes will not just impact residents and staff, but will impact the way in which providers do business in Pennsylvania. We're confident that the state's nursing home industry can withstand the improvements that are coming because every resident deserves nothing but the best care. We also look forward to discussing ways that we can partner with the industry to ensure ongoing viability of the nursing home industry in Pennsylvania, which may include increased reimbursement, critical workforce development programming, and other funding opportunities. Now, I'd like to introduce Kim Jackson, a licensed practical nurse from Berks County who has been working in nursing homes for more than 20 years. It's my privilege to now say, Kim.
Thank you. Hello, everybody. As she said, I'm Kim Jackson. I've been a nursing home LPN for over 20 years. And I'd like to thank you, Secretary Beam, and all of the cabinet members for being here today, because this gives me an opportunity to share what this direct care regulation announcement means to me. And I'm going to start crying because when I first heard this, that we were going to 4.1, it was just amazing. I couldn't even believe it. And it's going to mean, so much to me and to thousands of the nursing home caregivers across the state, as well as all of the people that we care for. Today, I have hope. And it's been a long time since I've been able to say that. For the first 10 years of my career, I worked at a nursing home that did the right thing. And they had good staffing. We had people everywhere. There was plenty of us. We could give the residents all the care that they needed. They got their showers in time. They got everything that they needed and everything that they deserved. But then I moved, and my new nursing home was completely different. It was like the difference between night and day. And even before COVID, they were providing the low standard of care that we currently had previously, and now it's changed. And it was way too low. That meant that some mornings I would come into work and I would see that I had 2 CNAs and they were scheduled to come in at 8 a.m. Now, our breakfast comes at 7 a.m. So did that mean that my residents didn't get to eat that day? Or did it mean that they were going to eat cold food once again? And that was not acceptable to me. And then as a nurse, the only one licensed to pass medications, some which need to be given before breakfast, I would have to run around and try to get, housekeepers or maintenance to come help pass trays so that my residents could get their food without it being cold. And it's not just at one facility, it's everywhere. It affects residents and the care that you provide in so many ways. Some days I'd be handing out medication to my residents, and then I would notice someone that had filthy long nails. And no one has time to do that. There's just no time to be able to do that. So, of course, I would stop what I was doing, which you're not really supposed to do, and I would trim their nails, and they would be so happy for just something simple as getting their fingernails trimmed. And we certainly didn't have enough staff to do special things like we used to be able to do, paint the women's fingernails, make sure women didn't have facial hair. That is a dignity issue. Every time I would see that, it just made my heart hurt. And there just wasn't enough time or enough people to help get it all done. For us as caregivers, it is very overwhelming. I never get breaks. I'm lucky if I even get to go to the bathroom. Sometimes I don't even remember that I should go to the bathroom. That's how bad it is. And you start to suffer from compassion fatigue. And I was at that place. I just care so much about what I do. I'm a nurse and I want to help people. But when you don't have the people to help you, you just feel like you've just lost. So we go into this work because we want to help people to ease their suffering. But at the end of the shift, you know that you didn't have time and your staff didn't have time to do everything that needed to be done. You know you didn't do enough for the people that are counting on you. Or you leave work and say, oh gosh, I forgot to call Mary's family back. And that's not a good feeling. You pick up extra shifts, but eventually you're just too tired to do that. Thank you for being patient with me. Nursing home care is time consuming. You can't just give a dying patient, and mind you, you don't just have all healthy people there. You can't just give a dying patient morphine and say, oh, sorry, I have to go, because you have a lot of other people who are, up in their wheelchairs or walking around, and they want their medicine. And it just makes you feel so bad that you have to rush in and give someone something to ease their pain as they're leaving this world. And sometimes I'm the only one they have. Their families hadn't been able to be there at COVID, and we did lose a lot of people, so I was the only one for them sometimes. These new regulations can help fix that. And it is a victory for all of us, and that's putting it mildly. All of us on the front lines doing this work, because we know that someone actually listened to us. We've known for a very long time that the current regulations weren't good enough, and that our residents were suffering, and it caused too much turnover. We spoke out, shared our experiences, and we never stopped advocating. Thank you to everyone who stepped up and is making this happen. I think about the great care that I'll be able to give, and I cannot wait for it to happen. And I know my residents will thank you as well. Thank you. Now I would like to introduce Ombudsman Margaret Barajas.
Good afternoon. I'm honored and genuinely excited to join Secretary Beam, Secretary of Aging Robert Torres, esteemed Commonwealth leadership, long-term care professionals, and especially skilled nursing home residents in support of this historic moment. As Pennsylvania's chief long-term care advocate, I'm responsible for resolving concerns brought forth by nursing home residents, and in this case, one of the best ways to resolve the #1 concern received by our office year after year is through improving the regulations that govern the provision of care. Today, the Pennsylvania Department of Health is announcing the details of this diligent, careful work. But the broader reasons for this update are well understood by those of us who have worked in and lived in long-term care. The bottom line is that we have an ethical imperative to assure that Pennsylvania's most vulnerable citizens are safe and well cared for. Nursing home residents are just like you and me, except that they need some help with activities such as walking, eating, or getting out of bed. And just like you and me, they want to live in a home where they feel safe and loved and well cared for. These are our mothers, our fathers, our spouses, and one day could be any of us here. Today, we're fortunate to stand here at a home that exceeds the staffing standards we're proposing. But in other facilities, where staffing hovers at the minimum, residents all too often suffer physically, mentally, and emotionally. We can change that. From the residents' perspective, they tell us their caregivers are overworked and rush from one room to the next. We can change that. Families of residents also suffer, worrying that their loved ones are not getting the care they need, and taxpayers all pay more when residents who have received inadequate care end up in the hospital or under protective services. We can change that. Residents and long-term care ombudsmen have recognized for many years that the minimum staffing requirement in Pennsylvania falls short of meeting the needs of quality of care and quality of life. We must change that. Because this is also about our future and what the future of aging can look like if we commit to doing the right things now. Pennsylvania currently has 3.4 million adults aged 60 and over, and this figure is projected to grow to 4 million in the next 9 years. As Pennsylvania's senior population continues to increase, the need for long-term care services will accompany that growth. As a state with one of the nation's largest aging populations, meeting minimum standards for long-term care is not good enough. We must lead, we must strive for excellence. By increasing the minimum number of direct resident care hours from 2.7 to 4.1, we will lead. We will help ensure that skilled nursing facilities are providing residents with high-quality care now and for years to come. So I thank you, and now I'll turn things back over to Secretary Beam.
Thank you both for the fantastic perspective. We are happy to answer any questions that folks may have on the topic of the regulations. Please.
Again, say in a best case scenario, when will this take effect?
Sure. So, as already alluded to, this is the start, and we know that it's going to be a tireless team of our dedicated folks getting the rest of the packages out on proposed and being able to then bring them together and have our final regulatory package that actually has the benefit of the comments of everyone put in place by the end of 2022. Part of that process will be a comment period that will ask folks, when should the effective date be? When can we make sure that this is going to be able to be operationalized successfully? And so while the regulatory process will kick off today with the first package going in, and hopefully throughout the rest of this calendar year, we're able to put the 4 more packages out on proposed, our final regulatory obligation we see ourselves as having is really being able to put final in by 2022, which will contemplate an effective date thereafter 2022.
And this doesn't require any sort of bill getting approved by the legislature?
So this actually is over in the regulatory aspect of our domain. The legislature, of course, will be a partner in this, and we will continue to communicate with them and update them as they have been this whole time. And they actually have the proposed regs with them as well today. But there will be no bill that will be necessary. Rather, this will be getting it through that regulatory review process.
And what or who, if anybody, could derail this?
So we are going to take into account all of the comments that we get when we actually solicit that public comment period for 30 days. We have a feeling is going to be voluminous in what the feedback is that we receive from folks. We understand that that will be an opportunity for folks to also voice opinions that may be in a different direction than where these regulations are going. Of course, through that independent regulatory review commission process, we'll also have public hearings where folks are able to speak their perspective. And all of those steps harness the potential for us to not necessarily prevail on getting these regulations through. But really, this is where having a team of leadership in this administration is going to be pivotal to educating folks as to why this is so critical and making sure that we stay on track rather than let any of those potentials derail it.
I mean, it sounds like you could be persuaded otherwise, but who, if anybody, is the final decision maker on, we've heard what everybody has to say, we know everything we need to know, and now this is the decision? Who makes that decision?
Sure. The Independent Regulatory Review Commission, or IRC, will actually take a vote on the regulations. After that, they do go to the General Assembly, and then there's an opportunity for us to finalize them and put them out as final.
Okay, one more thing I'd like to ask right now is, you know, we've heard over the years, we've heard a lot about the 4.1 hours and the 2.7 hours, and we also heard a lot about mandatory staffing levels. And you mentioned staffing levels as being separate from this, but what I'm hoping you can answer is, what's the difference between this and a staffing level? And if you could, what will this actually look like? Like, what will be different if they're required to provide 4.1 hours?
This is a great question. So we're starting by putting out the hours of care that a resident will receive. So if you look at it from a resident-focused perspective, nonetheless, another aspect of the regulations put forth a staffing ratio, which is what type of ratio you need to maintain to have the right number of staff for each of the residents that are in the home. That's when we talk about the staffing levels, that's really the part of the regulations that we're focused on. There are proposals that actually bring together these two aspects, right? That it should be a staffing ratio that is also contemplative of hours. That's being discussed within our internal team right now, the interplay between a minimum number of hours of resident care per day and the right number of staff to actually provide that. And so in forthcoming proposals, we'll be able to actually elaborate a bit more on how these two numbers should really be able to work together to make sure that not only is the resident getting the proper care, but the staff is also at that level that they aren't getting burnt out by delivering that number of hourly care per day.
Do you expect that some kind of mandated staffing level or ratio will eventually, or needs to be part of this, of the final package?
Yeah, that's actually contemplated in the regulations currently and will be part of the updated forthcoming packages.
Thank you.
Of course. Yeah.
So CMS had this as, 4.1 hours is a federal standard 20 years ago. Can you give a little bit of background? It's sort of been hinted at about what the conversations have been about that in the past and why it's taken 2 decades for this to even come to the regulatory table.
Sure. So I can, of course, offer what has happened under this administration, right? And during Governor Wolf's first term, he brought folks to the table to say, how are we going to improve our regulatory purview over skilled nursing facilities? What are we going to do better by residents, by staff, by families to allow us to update these regulations comprehensively and truly modernize them? With us putting out this first package, there are 2 critical pieces of it that I think are reflective of the work that he's done under his administration. One, allowing us to actually incorporate by reference some of those federal regulations, which will allow us a more expeditious updating moving forward so that we don't get caught in this 20 to 25 years again. But more than that, it's actually allowed us to go aggressive on pieces like this hours of care per day. And so I don't want it to be overshadowed. Both of those are critically important to making sure that we prevent against it being another generational gap before Pennsylvania's long-term care regs are ever updated.
So according to the PA Healthcare Association, they're saying that there would be a need to hire 7,000 direct care workers and that this would cost $4 million a week in new wages. How do you guys plan to hire all of that staff to make this happen? Because we know that a lot of people, we're in a staffing shortage right now.
Absolutely. So coming out of the pandemic, the workforce broadly in healthcare has been a concern. We wanted to make sure that not just our hospitals, but also those that provide the spectrum of healthcare have a pipeline of folks that are eager and willing to be part of the workforce that we so desperately need, and frankly were our heroes for the last year and a half and continue to be. What we're doing by way of some of the federal resources that we received is actually investing in that staffing infrastructure in Pennsylvania. And so hopefully we're able to actually have the recruitment tools, the compensation tools and the like, the education tools and the like, to have the workforce ready to be able to be hired by those entities. And I think really at this stage, we should have a higher expectation of us being able to also contain a lot of those folks that have been trained in Pennsylvania, retain them here, have a strong enough skilled nursing facility infrastructure that we can bring that workforce in, we can compensate them properly, we can keep them here, and have the ability to have our residents, again, be the beneficiaries of those increased hours of care.
Can you talk a little more about the federal money you referred to, and does it have anything to do with, the 7.3 billion from the American Rescue Plan?
Sure. So multiple pieces of federal money that I want to make sure I also offer clarity. Back in 2020, we had $850 million of the CARES funding went directly to skilled nursing facilities, which was really to allow them to, again, be supported while they were responding real time to the COVID-19 pandemic. The state budget then more recently passed roughly $250 million to again support skilled nursing facilities and in contemplation of things like workforce recruitment and development. For the Department of Health, we have also received strategic funding from the federal government to make sure that we are adequately prepared in the unfortunate event that we have another global pandemic. And part of what we're focusing on is making sure that our public health workforce across the board is going to be here and readily looking to serve the residents and the patients of Pennsylvania. And so I think with the financial supports that the federal government is directly allowing to have some of those skilled nursing facilities receive, the General Assembly and the administration working together to again pass more federal resources for these entities in the budget, and then also across our health and human services agencies and administration looking at those strategic funds that we can actually braid together to put towards workforce development, we'll be putting ourselves in a better position by way of being able to meet those staffing needs when this regulation goes into effect.
And raising the Medicaid reimbursement from the state, is that a necessary part of making this happen?
I'm happy to cede that to Secretary Sneed if that works well. Feel free to step up. Yeah.
Yeah, hi, I'm Meg Sneed. I'm the Acting Secretary of the Department of Human Services. We do anticipate that there will be a significant cost increase in the Medicaid program, but we are fully supportive of the department's regulatory update to promote better safety and well-being of the residents that are served in skilled nursing facilities throughout the state.
When you say you fully anticipate that there will be a cost, are you talking about, a cost that the state would be willing to pay? Is that what you mean?
Yes, so we do anticipate that there is roughly a $366 million increase that will, a large portion of which would be covered by the federal government, but nursing home care is covered directly by our Community Health Choices program in Pennsylvania. It's a managed care program, so the facilities and the managed care organizations are responsible for setting actuarially sound rates, and that's, in that process is where the cost adjustments would come into play.
That $366 million that you mentioned, is that the state's calculation of how much it will cost per year to provide 4.1 hours per day?
Yes.
I'm sorry, did you say how much money the state was going to give in Medicaid reimbursements to nursing homes?
Well, we anticipate the federal share to be $193.2 million and the state cost to be $173.6 million. If it were to go into effect as proposed.
Secretary Beam, I have a follow-up for you. Is anything going to change about the way the state is enforcing these requirements? Are there going to be stricter penalties or for lack of a better way of putting it, anything to incentivize homes to actually meet this threshold?
Sure. So us having a strong quality assurance aspect of this is of course important to being able to promulgate the regs, but also make sure there's compliance with the regs. We have really undergone, I think, in appreciation with our QA folks, an understanding of the importance of not just promulgating, but putting some action behind them. The discrete details of that, though, are always contemplated in forthcoming aspects of the regulations. Like we had mentioned, there will be 5 pieces of this package, and aspects like how are we going to make sure to enforce and bring compliance to the forefront for nursing homes will be contemplated in that process. Please.
Hearing things about Medicaid reimbursements and enforcement changes and everything else, that's a lot to get done in a little over a year, yes? in order to allow this to be an effective policy change?
It's an aggressive timeline. We're not shying away from an aggressive timeline. Our team has a dedication to this that existed prior to COVID-19 and frankly, I think was re-energized by what we experienced going through COVID-19. And I shouldn't say we, frankly, it's the residents, it's the staff, it's the families. What Pennsylvanians experienced going through COVID-19 bolsters our convictions to be able to get this through. Any other questions? Okay.
I do have to ask, so at the beginning of the pandemic, about 70% of COVID deaths were attributed to nursing homes. Is there any update on any investigations into that or any fallout from that?
I don't believe we have any update at this time, but happy to have our staff follow up as necessary. Great. Any other questions? Wonderful. Well, thank you all for coming out today. This is really exciting, and thank you all for sharing your stories and your time. Really appreciate the team effort on this, so thank you all.